Allow me to introduce Practice Management Associates with Lynn Nelson and Donna Lowell. Let's join them now in discussion.
Hello, everybody. We decided today we are going to talk about transitioning a dental practice during COVID. We have been deluged with that question since March, and a lot of concern about whether or not there is still the possibility of selling. Are there buyers? And so we want to talk a little bit about that practice that we closed in Washington State and also one in Oregon just recently. One closed August 12th and the other one is going to close August 31st.
Let's talk about the one in Washington State first. That was an interesting one because it was a client that when we put it on the market, he was ready to go, wanted to sell it as quickly as possible. So, of course, we jumped on it. And when did we first meet him?
We met them at a seminar a couple years ago, 2 or 3 years ago.
Oh, our seminar.
Our seminar, right. And they signed up to participate in our Practice Protect program, which keeps their data up to date should something unforeseen occur, allows them to have their numbers every year they get updated. So they were in a great position. Because we had everything we needed, all we needed was year-end numbers, and then we could go to market.
Yeah, because we got that perspective turned around really quickly.
And they had planned initially to not retire until 2021, but he was becoming increasingly frustrated with dentistry, insurance, etc. And after meeting with their financial planner, they decided, let's just do it.
That's right.
So he wanted to go on the market January 2020.
Yeah, and we got that turned around really quickly, started showing the practice, and then COVID hit. And in Washington State, the governor actually closed dental offices down before he closed down the rest of the population. Yeah. And so I think they closed around the 18th or something, something
somewhere
like that.
In there, March 12th, 18th, something like that. I don't remember.
Yeah. But we really felt like this was going to be a struggle, and were pleasantly surprised that there were still plenty of very interested buyers. Luckily, it was in a really desirable location. The practice itself wasn't a big practice. I would definitely put it in the medium-sized category. But it had a lot of potential. It had real estate that went with it, so that was really nice. But we met in masks, and we
couldn't shake hands.
We still aren't supposed to shake hands. So don't ever shake my hand.
I'm not going to. Well, also, we had a seller that had sort of pre-retired.
Absolutely. I love that expression, pre-retired. Yeah. He really had.
They weren't working that many days, 3 days and a half or 2.5 almost. It was low hours and a lot of possibility in the practice.
But still a pretty nice patient base.
Oh, sure.
I think that
great patient base.
Hygiene department was still he allowed his hygienist to see patients outside of his hours, which was nice. And everybody was very interested in the real estate piece of it. It seems as though people are still very interested in owning rather than leasing for obvious reasons, taxation and such. But his building was rather pricey because of the land that it sat on. So that became a little bit of an issue, if you remember. But and I think we ended up leasing. He ended up leasing, so that giving the buyer 5 years or so to start saving up and working towards a down payment. Yeah, we ended up getting 3 buyers, one letter of intent and 2 backups. And that was really nice. Nice for him to, the level of confidence in those buyers was, it was nice to see, even though we were in this uncertain time.
Not even seeing patients.
No, not even seeing patients. So they were impressive people. Out of all of the different characteristics of that transition, what would you say some of the ups and downs were?
Well, the up is obvious. We had great interest in the practice and solid buyers. Mm-hmm. The downside was banking, because the banks had gone dark, and our buyer that submitted the letter of intent had been approved for financing with an institution, and we were told, I had a long discussion with the banker, and his advice or his information was that all that they were going to require was 2 weeks of production once the practices began seeing patients again.
I forgot about that.
And which was surprising and turned out to be false, quite false. He went completely AWOL. We could not get him to return calls to us or to the client. So the client did seek out alternate financing, and that was fortunate. Mm-hmm. But there were some wrinkles in that as well.
Right. Well, and I think really it's true today that lenders are very reluctant to lend. I think in the beginning it was probably due to all the PPP loans that they were working on for their own portfolios in dentistry. And so I think they were overloaded with that. But I also think, banks are operating with risk in mind, and with COVID, something like this that is just unprecedented. They didn't know what to think. Right. So a lot of banks went dark, and I think now we're just starting to see people start to want to engage with us and with buyers and that type of thing. We've been getting calls, so that's nice to see. But for a while, there was really only one bank that was doing the lending nationwide, which I'm sure they were
inundated.
Yeah, and still are. Mm-hmm. But anyway, I think, that is that unless you're going to completely carry back, lending is probably the issue right now on whether you can sell your practice. But the good news is if you have a solid practice and you just want what's fair,
right,
and the numbers work and everything cash flows, there's still plenty of very confident buyers out there that are looking for practices. It's still a seller's market, even through COVID. Mm-hmm. And I think even the other practice that we sold, it was an emergency sale due to COVID. Yeah. The Oregon practice, where the husband could not work in the practice because he had health issues, and his docs told him, no more, you just can't do it. And unfortunately, he wasn't really ready to retire, but he knew he had to for health reasons. So that was an interesting one.
Mm-hmm. Even more interesting because that one stayed dark. Is still dark.
Yes.
But
when's that supposed to close?
August 31st.
That's right.
Yeah, and the buyer is in there. They're working with them beautifully to get the staff re-energized, and patient base letters have gone out. So that one's going to be great for all concerned, other than the fact that he wasn't ready to retire. He feels very, very good about the person that we found.
Maybe they'll get a vaccine and he'll be able to go back and help her, because I know she was really open to that.
Yep.
I think that in that situation too, where a practice goes dark like that, it was really impossible to get conventional financing or even SBA financing. Mm-hmm. So we ended up being able to put something together with the buyer putting down 25% and the seller carrying back 75%. And so she has skin in the game, and he feels good about it. And eventually she plans to buy his building too.
That's right.
And so it's kind of nice to see them both working together like that and helping one another. I mean, I've never seen a better goodwill letter in my life.
I know, me same. And it's too bad that all transitions can't be like this, because it's really been special to be a part of it. You watch they contacted staff that have been with them in years past and got them all together to see who could come and donate not donate, they'll be paid, but spend some time helping her so there's a familiar face in the office when the patients come back. And it's just been really rewarding to watch that. Really, really cool.
And she's updating equipment and she's going to continue to work outside the practice a couple days and just work in the practice. And eventually when she can, she's going to refinance that.
Buy the building.
And buy the building and the practice, refinance the practice debt, buy the building. It's just a win-win-win.
It really is.
So that was fun to be a part of that.
It really was. Well, you know what? We are out of time for today. But to answer that question, yes, you can still sell your practice even with COVID-19.